So, good afternoon and welcome. My name is Tara Feiner, and I am the Director for Jewish Family Services here in Dayton. And we are thrilled to have everybody here with us this morning on behalf of Jewish Family Services, chaired by Michelle Dritz, and our JFS Program Committee, chaired by Helene Gordon and Marianne Bernstein. Welcome to our third in our 2021 series of Head, Shoulders, Knees, and Toes. And today it's Fit Matters. We are excited about this session that focuses on footwear and the impact it has on our health. Just a reminder that we make this presentation available as an educational resource and not medical advice. As always, make sure you talk to your doctors and your medical teams for advice about your specific situations and your needs. I want to introduce our speakers today. From the Hanger Clinic, we have a couple people with us. We have Cherie Ford. Cherie is an Australian clinician that recently moved to Ohio, who previously worked in Texas with the Hanger Clinic. We have Mark Graham, who did his undergrad at the Ohio State University. I've learned being here for 6 years, 7 years is important to put the in front. So I've learned that, and received his MSOP at Eastern Michigan University. And he is a certified prosthetist, orthotist, and has worked 10 years at the Hanger Clinic in Dayton. And we have with us also Emily Machuski. Did I get that right, Emily?
Close enough.
Please say it right.
Macheski.
Thank you, from the Hanger Clinic. And we are looking forward to their expertise and learning from them today. As always, just so everybody knows, we will have people muted during this session so that there is no background noise, so that everybody who is here with us can have the best possible experience, so they don't want to hear dogs and cats or children or papers rustling or the secrets that you don't want anybody else to know. So, and then it's up to you whether or not you have your camera on. We would love to see your faces, but sometimes people just don't want to be seen, and that's okay too. So without further ado, welcome Mark, Cherie, and Emily.
Thank you.
Thank you. All right, so I am going to be starting us off today. We're going to be talking about health, and particularly in terms of footwear and health, and how good foot health is important. So we can go to the next slide. All right. So what are we? In terms of clinicians, we talk about an orthotist or a CO. That's an allied health professional who's trained and educated to provide custom designed orthoses that are external orthopedic braces. In terms of prosthetics, we have a certified prosthetist, and that's an allied health professional who's trained and educated to provide custom designed external prosthetics. And we have the joining of those two in terms of a CPO. All right, Hanger Clinic provides orthotic and prosthetic solutions that 1 million patients annually. We have a really large number of clinics across the country, and Hanger Clinic employs 25% of the nation's O&P professionals. So any one city has likely more than one Hanger Clinic. So Dayton as a market, for example, has 5 or 6 clinics, which obviously means, you know, we have a lot of clinics. It's nice, we can be close to people. Next. All right, footwear. Why is it important? It's very important because it's our base. Everything starts from the ground up. It's where we bear all of our weight through, and it sets our whole body alignment. So the first area to show poor vascular effects are our peripheries. And so that particularly starts with the feet. They're the furthest from the heart. And so with conditions like diabetes and blood clots, it's usually seen in the lower extremities first. Footwear is important because there are different aspects to it. So we talk about shape and size in terms of length, width, and depth. Next. So let's look at the anatomy of a shoe. There are all different types of shoes. Some have all of these features, some have only some of these features. And this is not anything anyone has to remember, but good as a reference, and particularly when you're looking for shoes, certain aspects will be more important than others. So a tongue, nowadays we see shoes that have the tongue sewn into them. So that removes the adjustability of being able to undo the laces fully and move the tongue out the way. The collar is a good section of the shoe because that provides ankle stability. If you've got a high collar, people think that provides more ankle stability. We've got the sole. There's different layers of the sole, the outsole, the midsole, eyelets. Sometimes instead of a threaded through eyelet, we have quick eyelets that are hooks. There's the counter at the back of the shoe. Again, not super important to remember, but good to know and good to keep an eye out when you're thinking about the type of shoe that you need, if you're shoe shopping or, you know, with a professional like Mark or myself. Next. So again, we're going to look at the anatomy of the shoe from a different angle. We talked about the sole previously. So now at the back of the heel, we can see that there's an insole. Often if you're going to have insoles in your shoes, orthopedic insoles, it's good to have shoes that have removable insoles. And so the insole out of most shoes will come out. They're usually just glued in with a little bit of spot glue. Toe box is really important because the width of that might indicate whether a shoe is wide enough for you or not. And the waist, I guess, is mostly adjustable with something with laces. If you have a shoe without laces, something with just kind of elastic on the sides like a loafer would, or if it's something with just Velcro, they can be a little bit harder to adjust these widths, the throat, the waist, and getting down closer to the toe box. So again, something good to think about. Next. So if we look from the inside of the shoe, we've got that kind of heel stiffener that's going to provide the support at the back of the shoe. And then there's support at the front of the shoe from the toe puff. Now the heel drop on here is something that we also call the pitch of the shoe. So that's the difference between the height at the back and the height at the front, which will give you momentum through gait. Changing the pitch of your shoe changes the alignment of your limb. So different height shoes will act differently on your limb. Next. Okay, so footwear is constructed over something called a last. A last can be made out of various different materials, but basically what you see here is what they're designed over. So the shoe is put together in different stages. The sole is the last part to go on. Usually the upper is made first over the last to give it its shape and its size. Next. So this slide talks about how each manufacturer has their own set of lasts. There'll be different sizes, different widths, and so basically a size 10 in a neutral shoe from Nike is not going to be the same as a size 10 from Adidas or New Balance, or, you know, any other shoe company. So saying you're a size 10 in one shoe doesn't mean you're a size 10 in every shoe. I'm sure most of you are aware that some shoes are wider than others. So again, saying you're a standard width doesn't always have the same effect. Next. Okay, so typically, if you're like me, you find a shoe that fits well, you're probably going to try and buy the same shoe over and over again. You'll see all of its generations throughout the years. But that typically comes from the shoe being built on the same last. So, for example, my running shoe for all of my teenage years was the exact same shoe, just in its new year generations, because it was built on the exact same last. And I knew that fit my foot well. Yes, and this information can be available to you if you're willing to go and search for it and ask for it. Next. Right, so I think we've all had a pair of shoes that don't fit well, whether it's in length or in width. And so our shoes are never really made to fit from our heel to our toe. When you're in clinic here with us, or if you're at a good shoe store, they'll use something like this device here, which is a Brannock device. And basically what we're trying to do is put your heel as far back as we can, and then with the little lever on the bottom section there, we line that up with the ball of your foot, and then the other flat side is measuring the width. So when we measure a shoe, we're measuring the length from the heel to the ball of the foot. If you've got long, slim toes, that can be accounted for in something like this, because obviously we will measure to the toes. But again, you'll find different shoes have different toe lengths than some others. So it comes back to a size 10 might not be a size 10 in every shoe size. Next. Okay, so appropriate styles of shoes. I actually picked out this slide, and I picked this out for a reason, because I really like lots of these shoes. So in terms of boots, there's hiking boots and there's working boots. Hiking boots are really great for ankle stability. They come up nice and high around the ankle and often have laces all the way up. If your shoe doesn't have laces all the way to the top of the shoe, it's not supporting you to the top of the shoe. Work boots typically have, steel toe or a composite toe, and are usually not laced. So it's fit as you go, whereas something with laces you can pull tighter and make it fit to your foot. The sneakers that you can see in the center are now my running shoes. They are a very, very good running shoe, but they are made for running as opposed to something like the Cross Trainer, the black and white shoe next to it. And you can see the difference between those two shoes in the sole. Obviously, a running shoe has to take a lot more shock absorption compared to a cross trainer. So thinking about that when you're looking at different shoes, you obviously don't want to be running in a shoe that's almost flat, because that's going to put a lot of stress on your limb. And then again, walking shoes are different. So a sneaker isn't just a sneaker, it's a type of sneaker. Then we get into dress shoes. Often women will wear shoes with heels. Again, it's important to think about where you're placing your weight with the shoe. Something with a heel means that you're taking almost no weight through the center of the foot. You're taking a lot of the weight through the ball of the foot. and a little bit of the weight through the heel of the foot. People who wear heels all the time tend to get painful balls of their feet very early on in life, and then need corrective insoles. So having something like a wedge instead of a heel would be better if necessary to wear heels. And then we talk about slippers and house shoes. I always say having something with a sole, a hard sole, is better than not. And in terms of sandals, you really can't go past something with some arch support, and something that's going to protect your foot a little more than a flat flip-flop. Next. All right, so footwear. Why do we wear shoes? You know, sometimes I think we don't go all the way back to the basics and think about what are we trying to achieve with this pair of shoes that we're wearing every day. So our shoes are our first form of protection against the environment, which includes water and debris, you know, things on the road or on the grass or in the clinic, and for temperature management. We also wear them for comfort. I don't know about everyone else's feet, but my feet don't do too well on the road in Texas in the middle of summer. So we wear them for comfort and cushion, again, going back to those running shoes, and support. And we need shoes that fit appropriately. So length, height, and width are important to remember. Style's always an interesting one to talk about. I know that people, you know, like to wear certain shoes for certain reasons, but at the end of the day, you've got to take care of your feet first and foremost. Style is not going to be important if you don't take care of your feet early on in life, because later on in life you'll be paying for it, and style will then not be a thing. So sometimes managing style for support is more appropriate. Also, we have shoes that are made for accommodation of deformity, or an orthosis or multiple orthoses. So custom made shoes are something that I'm very familiar with, for people with foot deformities that require, you know, fairly thick insoles, or orthoses in terms of calipers or AFOs. Shoes can be to accommodate different things. Next. Okay, so again, this slide kind of just goes back to what is appropriate and different styles of shoes. So there are 4 components to a diabetic shoe, and you know, we talk about variable width. I think we all know, you know, we've all tried on shoes that have been too narrow for us or way too wide for us, and I picked the New Balance picture here because I think that's a really good indicator of the difference in the width of a shoe. So New Balance make several widths of shoes. On top of the 4E, they also have a 6E, and they're fairly readily available. So there's no reason to go into an orthopedic shoe if we can get you to fit into something appropriate that you could buy off the shelf. We want to have a round toe box so that we have room for your toes. The last thing we want is your toes cramped in. We want to have a high toe box if we're using something like an insole, because that builds up the height inside the shoe. And we want to have some form of closure. Anything that slips on and slips off is not going to be appropriate, because it's not going to hold your foot well within the shoe. Something like the shoes on this slide with laces will hold you back on the insole and hold you in the shoe and prevent friction from your foot moving around. Or again, something like the Velcro here. And then we have custom shoes that we can make as per the need. Next. And I'll hand over to Mark Graham.
All right.
And I'm
Yep.
sorry if I can just, I apologize, Mark, to interrupt, that I neglected to say at the beginning that if you have questions, they can be entered in the chat box and Emily is monitoring and we can ask questions as we go. We'll also have time at the end. So I wanted to jump in with the transition from Sherry. Thank you so much about the shoes. I've been looking at my feet and what I'm wearing as you were speaking and transitioning to Mark. So thank you, Mark.
Yes. Now, can you see the pointer on the screen?
Yes.
Okay, good. So yes, I'm going to be talking about the conditions affecting the foot that would in turn affect the fitting of a shoe. And also what type of orthoses that we would provide for that type of condition. As you can see, a number of relatively common conditions that can affect the foot here. We're going to go through each one in the sequential slides. Edema. So when we see a patient come in with edema, obviously they've got excessive fluid in their limb, and we don't necessarily provide compression hose, but that's something that we would certainly recommend. If they have lymphedema, then obviously lymphedema wrap. But a lot of times they'll come in wanting a shoe. If you look obviously to the right here, we have a shoe that has a Lycra top, which is elastic. And then also the collar has a nice, thick, elastic, soft collar of the shoe. So it accommodates fluctuation in the swelling. It's not uncommon for an edemic patient to also have drop foot, which we'll talk more about, which is where they're not able to pick up their foot as they're walking, so their toes would catch and potentially cause a fall. So this particular brace here goes up the leg just below the knee, and the only points of contact are the calf and the foot where the shoe is. And obviously the shoe would be an extra depth with shoe to accommodate the swelling. And whether it's laces or Velcro, there's no contact here where the metal is typically, and if it is, it would just be mild. And they do that on purpose so that if there is fluctuation in swelling, again, it can accommodate that. One thing to avoid with edemic tissue is socks that have the elastic band at the top. I'm sure a lot of healthcare workers are familiar with those, and definitely want to avoid that because that reduces circulation. Toe deformities. Shri alluded to some toe deformities, and that would come about if the shoe is too shallow, top to bottom inside of the toe box, too narrow or too pointed, and particularly if someone has a claw toe, hammer toe, or mallet toe. As you can see, the claw toe has the two knuckles of the toe are flexed, which distinguishes it as a claw toe. The hammer toe, it's the second knuckle that is flexed, and these are rigid deformities. And then the mallet toe is the first knuckle, and that's how you would classify each one. And of course, where you see the red spots are points of pressure or friction inside of the shoe. And then of course, on the bottom of the shoe or floor are potential ulcer sites. How we would address that again is an extra depth shoe. Shoe that will accommodate the increased height of the toes. Also a mesh or a leather that can be stretched if need be, or just open up on its own. So corns, calluses, and bunions. A lot of people just call these calluses. Corns are distinguished because they're located on the top or the sides of the toe. They're generally smaller. Here you can see a corn on the fifth toe. Calluses are typically on the heel or ball of the foot or outside of the big toe. So here you can see a callus here, there. I think we all know what calluses are. They're relatively common. As we age, we can have more prominences in our feet, and more calluses can develop. Bunions are typically due to a malformation of the bone. This is what we would call hallux valgus. Bunion would form and then create a large callus, or otherwise known as a bunion. People with diabetes must take special care with these because if a sore develops, things take a lot longer to heal and can not heal properly. So it's important that they see their PCP, podiatrist, or endocrinologist to seek appropriate diabetic care. All right, ulceration. So certainly something that we want to avoid. If it does develop, we want to get prompt care because it can lead to amputation, and more than 80% of amputations begin with foot ulcers. Here you can see on the hallux of the first toe, we have an ulcer site. Here's the first metatarsal head. Those would be typically addressed with a foot orthosis, custom foot orthosis. Generally, these are patients that are diabetic. Typically, the doctor wouldn't send them to us until they're a little more healed than this particular one. But what the orthosis will do is unload that pressure spot with this device, foot orthosis here. These do take up a little extra room in the shoe, so that's why an extra depth shoe is important. This particular one is at the midfoot. More likely, this is Charcot foot. Something we'll talk about a little bit later. The classic boot for Charcot foot would be the Crow boot, which is an acronym that stands for Charcot Restraint Orthotic Walker. Essentially, what it's doing is it's offloading from total contact with the boot, offloading the foot to help reduce the pressure and promote healing. And this is a heel ulcer and a corresponding boot. As you can see here on the heel section, there's a cutout. And then if you look closely, you can see that there's no soling there. You would see a posterior view, you'd see a U shape. So there'd be no contact with the soling to unload that particular section. So these are all three are relatively successful in improving ulcerations. Amputations. A statistic in regards to amputations that every 4 minutes in America, a limb is amputated due to diabetes. Diabetes is the leading cause of amputation for non-traumatic lower extremity amputation. There was research done from 2000 to 2017 showing that after a period of decline of amputations, it started increasing. In particular, were the young and middle-aged adults, which were less than 75 years old. But prevention of foot care has shown to reduce non-traumatic lower extremity amputations. So just to go over these and the devices, here we have again, relatively common toe amputation of the first digit, first toe, and then a corresponding foot orthosis with a toe filler. Here you've got toe fillers or transmetatarsal toe fillers, foot orthoses that we would provide for a patient, as you see in the picture. This device here would be added for when we have amputations that go further up the limb. I'm going to move forward one slide and then come back. And this just shows you the foot amputations that surgeons would remove and where those would be located. So this was the transmetatarsal, metatarsophalangeal disarticulation, toe amputation. The one in the photo here was transmetatarsal, which correspond with this. And then this particular one probably, I believe, is a show part, which would be amputation here. And this device would be used for show part amputation, Liz Frank, or even a transmetatarsal amputation to provide additional support with the lever arm, because as you can see, there's less area to distribute the pressure, so there's going to be more pressure over on the end of the limb. So we want to reduce the amount of motion and friction and provide additional support there. What you see here is an actual prosthesis for a Symes patient. And a Symes amputation would be an articulation, or not an ankle or disarticulation, but just above the ankle there. Charcot foot. So we talked about it a little bit earlier. First, the healthy foot, you can see a nice arch in the foot. Charcot foot comes about due to weakening of the bones and the patient continuing to walk on it with neuropathy, which is a loss of sensation. And the weakness of the muscles and the bones leads to a muscle imbalance. And that can lead to deformities, hammer toes. Let's see. And the rocker bottom deformity that you see here. Again, the Crow boot is the classic and standard device that is used. Again, we're trying to unload the foot to reduce the pressure, to prevent ulceration or to promote healing if it is ulcerated. It does work well, again, because of the total contact that redistributes the pressure to unload the foot. All right, Charcot-Marie tooth. So with Charcot-Marie tooth, it is associated with neuropathy as well. However, it is hereditary. It can first appear in adolescence and early adulthood, but also can develop later in life. As you see, it, part of the deformity is a high arch, and that also is due to a muscle weakness, causing an imbalance and a bone deformity. It is relatively slowly progressive and results in foot drop. And this device would prevent the foot from dropping below 90 degrees, preventing the foot from dragging or dropping, causing a fall. And typically, a lot of the CMT, which is Charcot-Marie tooth patients, also wouldn't have the ability to push down due to muscle weakness, which is the ability to raise your heel necessarily to prevent falling forward. drop foot. So there's many conditions that are conditions like stroke, trachea tooth that cause drop foot, even post-surgery of the back or a leg, hip, knee surgery can affect the nerve or muscle strength. And a AFO, which you see here to the right, would be recommended for that. AFO stands for ankle foot orthosis. Orthosis is the medical term for brace. And as you see, they can be made out of different materials. Here is a carbon fiber material, which we can use a lot less of it. It's a lot lighter weight and it's more dynamic. I refer to this, if we relate it to vehicles, as a Corvette model, whereas the plastic more like a utility vehicle. It does do more, provide more functions. As you can see, it has higher sidewalls. We can articulate it. We can put stops or put joints on it that would restrict motion completely or allow some motion, dorsiflexion or plantar flexion, etc. So there's different varieties for different conditions. Again, this one would be for someone who has more instabilities side to side and front to back, or this would just be more front to back instabilities. Posterior tibialis, tendon dysfunction, or PTTD, and osteoarthritis. They don't have drop foot, but they've got significant pain, foot deformity. As you can see here, this is something that we see quite often, where they have heel valgus. From the posterior view, you can see that the forefoot, compared to a normal neutral hindfoot position, is visible, where here it is not. And then you have the collapsing of the arch, where the midfoot is lower or all the way on the floor, something also referred to as pes planus. Braces that we would provide, depending upon pain level, we can go with something that's a little more conservative, that has 360 control, which are these leather ankle gauntlets, and that's going to immobilize the midfoot and ankle to reduce pain and stabilize it, prevent further deformity of the foot. This one would be would allow anterior posterior movement, but manage the side to side instability. So sometimes we can maximize correction. Sometimes we're just accommodating, but not allowing it to further deform. And of course, we're always trying to minimize pain. So goals of orthotic intervention, as you can see, we're trying to stabilize. We're trying to manage the motion, reduce pain, trying to avoid or manage ulceration, unload it, promote healing, or prevent it altogether. Going back to the foot orthosis, I'm going to skip ahead to the slide and I'll come back. The foot orthosis, the type of material that's made out of, is custom to the patient. So for their prominences, there'd be reliefs. But also, if you look at this, you can see, if you look closely, there are 4 layers here. You've got the top layer, which is a plastizo, which actually forms to the patient's foot. And then the next layer is called PPT, and that's very resilient. So you step on it, it provides cushion, but it collapses. And then once you take your weight off it, then it relofts. The next layer is a firmer foam, and the next layer is an even firmer, foam. Let me go back. Providing multi-durometer of foams there to provide support and comfort and unloading of prominent features like bones or unloading of ulcers. We're trying to manage or prevent deformity. Again, whether we can get correction in the deformity or maximize it or accommodate it. We're basically looking for optimal alignment. And we're trying to improve function, improve activities of daily living, and promote safe function, maximize normalcy in their life. So going back to this slide, so shoes and insoles, again, whether it's some type of callus or toe deformity or edema, we can manage many of that with shoes and insoles that have appropriate depth, width, and length to accommodate their condition. These are AFOs, again, ankle foot orthosis. Again, orthoses is the medical term for brace. And there can be different types of materials that it's made out of based on what we're trying to achieve for the patient. Any questions? I will mention that our main office is in Dayton at St. E's Hospital on the south side. Our Centerville office exclusively does shoes and insoles. So if shoes or insoles are needed and that's all that's needed, then we would send you to our Centerville office. If shoes and insoles and some type of AFO or full leg brace or back brace is needed, then we would have you come to our Dayton office.
So, Mark, great session. I've been watching the chat box. I've been watching Cherie respond, and I think we can let you, Cherie, and Emily moderate the questions and work through what's in the chat box and then open up. Maybe if we stop sharing so everyone can see full screen.
Yes.
And then everyone can see each other. And as we do the Q&A, so Cherie, I'll let you kick off and see what you want to address that's been in the box, and Emily, and I'll step back.
Yeah. Okay, well, let's kind of start from the start. So, Lorraine, you asked about negative heel shoes. I think negative heel shoes have a very specific design and can be very useful for a few types of foot and ankle issues. If that is something that you were told to wear by a professional, then by all means. If that's something that you have decided to wear, I would see how things play out for you. So in terms of negative heel shoes for everyone else, this is, we spoke about the pitch, the difference between the heel height and the ball of the foot height. Negative heel shoes almost do the opposite. So they've got a taller toe and a lower heel, which instead of our foot being slightly lower down compared to our straight up leg, which encourages propulsion through gait, we've got the opposite effect. So our foot is slightly higher up. That means the muscles in the back of our leg are being lengthened throughout gait, which is good for someone who's been wearing high heels for the last 5 years or something, because their muscles are very short and tight. So negative heel shoes can be good for certain things. If you try them and they're not working out for you, I would seek other help or other suggestions. I'm probably going to say this wrong. I think it was Helene asked about some good brands for women. I think the Allegria shoes are great if you need insoles. They fit in there nicely. They are very, very widely used in the medical industry, and they wouldn't be if they didn't have, you know, good support and weren't comfortable. Any shoe is really about how it fits you. If you buy the best shoe in the world and you buy a size too small in length and a size too small in width, you're going to have some sort of problem. It really is about getting the right size shoe for you. I think a lot of people also forget that our feet expand as we stand up. So trying on a pair of shoes sitting down is not going to give you the same effect as trying on a pair of shoes when you're standing up. In saying that, people who have diabetic neuropathy and maybe don't feel their feet the best, might be best to stand up on a piece of paper, have someone trace around their foot, and then when you are shoe shopping, pull out the insole from the shoe and place that foot cutting over it. That is a good way to see if your expanded foot is going to fit on the insole of that shoe, because that insole of that shoe is basically the shape of the shoe. If the insole of the shoe fits down here and your foot is like this, you can safely say that's probably not the right shoe for you. So something simple like that can really help when buying shoes if you have sensation issues.
Thank you. And it was.
Yeah, okay. Good. My mum wears Allegria shoes, and she's not in the medical field, so I know how comfortable they're reported to be. And if they're not causing any issues, if you're not getting red spots, if you're not getting blisters or anything else, then I think you're doing fine. Anything to add, Graham?
I was just going to say, I typically will recommend that there be a thumb's width from the end of the toe to the end of the shoe, particularly for diabetic patients that and that have neuropathy. That way they're not stubbing the end of their toe as they walk. That can definitely be an issue.
Yeah. And to that point, if you've got the thumb's width at the end of the shoe, you've got room for your foot will translate a little bit in the shoe as you walk. If you have something, again, we go back to laces or Velcro, that helps to keep your foot secured in the back of the shoe. If you've got a slip on, your foot is going to move inside the shoe, which can then cause damage to your foot. So, again, fastening of the shoe also affects the fit of the shoe, but yeah, good point. Richard asked about how do I know if the shoes I have are right for me? I think in terms of that, you probably need to let your feet talk to you. There are billions of shoes out there that you could be wearing. If you're wearing something uncomfortable, it's not right for you. If it's causing problems, it's not right for you. Try something different. And that he's got orthotics, he's been trying to adjust to them for over a year. This is a very long time to be adjusting to orthotics in terms of foot orthotics or custom insoles or something of that kind. Typically it will take a good amount of time, and I mean, if you think about your body, how long have you been walking on your feet in the way they are? Some people who get insoles as little children and grow up with insoles tolerate different insoles throughout their life a lot easier. Whereas if you've got a pair of insoles for the first time and you're 50, I'll pull out a random number, 50, it is going to be more of an adjustment. So I wouldn't rush your body into it, but I would think a year is a long time to get used to a pair of insoles. Graham?
The question was?
So I've got some orthotics. I've been trying to adjust to them for over a year. Is this normal?
Yeah, I would say definitely not normal. I would go back to whoever provided them for you, see if they can make some modifications. I would look at, discoloration of the foot, any type of callousing, and then make appropriate modifications as needed, and then do another follow-up and see how they do. Time is going to be the best indicator of how it fits.
Mm-hmm. And the first pair of insoles is not always the final pair of insoles. Sometimes some people's insoles need tweaking and tweaking and tweaking until something clicks, and then we know what works for you. No two people's feet are the same, so we just have to work out what works for each individual foot.
Yeah, definitely a process.
Yes. And then Alan asked about, is it advisable to go barefoot or to wear shoes without socks, particularly if you have diabetes? I addressed this in the comments box, but I will say it out loud for anyone who didn't read it. I would say typically it's never encouraged for someone with diabetes to go barefoot or have shoes without socks. The shoes without socks is not encouraged at all, but the going barefoot is almost an absolute no-no. When you have sensation issues or even vascular issues, the last thing you want to do is be exposing your feet to all of the elements that you're walking over. If you can't feel 100% in your peripheries, then there's no way of knowing what you're walking on. So I would say definitely not to the walking barefoot. Even if you're in a place like your house, your bedroom or your office or whatever it is, if there's a tack on the floor or something simple like a coin could do damage to the skin of your foot if you're walking around barefoot. I get a good pair of house shoes. The next question we had was, are insoles always supposed to be removed when wearing custom orthotics? I've been wearing them for 20 plus years and no one has ever advised me to remove the insoles. Finding shoes to wear with them is a continuous struggle. And then again, I replied to this in the chat, but I will say it again. It's not compulsory. You don't have to remove the insoles from the shoes, and different people will do different things. So for someone who has a more shallow foot, they might find that leaving the shoe insole in and putting their custom insoles on top takes up some of the depth of the shoe, so then their shoes fit a little better. Someone with a taller foot will definitely need to take out the insole from the shoe and put their custom insole in, because that will buy them a little room, a little depth within the shoe. So it really is whatever works for you. And again, different shoes are going to require different things. But if you've been having trouble, then I would try a different pair of shoes, and I would try removing the insole and seeing if that helps. Okay, so we've got another question here about, what do you suggest about bathing the feet? What is the proper way to dry the foot after a shower or a bath? I would probably default to a podiatrist here. I think they would have a lot better idea in terms of care for skin than we would. Obviously, in terms of drying the feet, that is very important, because if your feet stay moist, your skin is going to start to have some issues. Often I find people who have reduced sensation in their feet will sit down in the bathroom, whether it's on a shower chair or the side of the bath or another chair, and dry their foot, pick their foot up and dry their foot with their towel, and make sure they're looking at the bottom of their foot and drying between their toes. But again, I think your podiatrist would probably have better ideas here. Graham, do you have anything to add to that?
Yeah, I would concur with that. Definitely seek medical advice from your doctor. However, and just to piggyback on what you said, yeah, we want to avoid excessive moisture. We want to make sure that the feet are, after they're cleaned, appropriately dried. You can use some type of appropriate foot powder to avoid excessive perspiration. And as a side note, yeah, if you have excessive dryness, an appropriate lotion is appropriate for avoiding cracks in your skin that could cause a sore, skin breakdown, etc. So certainly don't want an infection to develop due to dry skin. But again, nothing excessive. We want to avoid excessive moisture.
All right, I guess we've addressed the questions in the chat.
So I had a question about buying shoes at a shoe store. Is there, if someone is really concerned about looking for an appropriate fit, is there any kind of certification or licensure that people could look for with a store that would lend itself to, you know, someone's going to work with you for an appropriate fit for your needs? I don't know if I'm asking it that the right way.
No, I think I understand your question. You're just wondering if when you go to a store, is there a certification, like you said, certification to look for where you know that they've been trained to fit people appropriately with shoes. And, you know, honestly, I am not aware of shoe salesman certification. I'm encouraged when I see a Bronick device, which was the foot measuring device that one of Emily's slides, because then that tells me that, okay, well, at least I don't have to try on several shoes to figure out, you know, what my current size is, or if there's a change in my foot. And I will say something important, a bit of a tandem, but as we age, particularly in our older years, our foot can lengthen. Our arch can start to collapse. Take my mother, for example, who is in her 70s. She had a little bit of a dramatic experience because she likes small, petite shoes, and she's always been a 6.5 narrow. And she no longer can fit in the 6.5 narrow because her foot has lengthened. And that can happen to all of us. You know, just be aware that your foot can change size. So don't try to cram your foot in something that we've always been that size, because it can change, and not just due to the foot, the arch collapsing, but due to swelling, due to a deformity that's developed. There's a number of conditions that can cause that. So it's not a bad idea to check your feet in terms of width and length. Did I answer your question?
Yeah, yes, you did. Thank you. You know, I didn't want to put you on the spot and name a good store. I just didn't know if there was something that we should look for. So that's appreciated. I'm when someone comes into our office, you know, we'll tell them that you know, you can find it not necessarily anywhere in terms of an extra depth, extra width shoe, but Kohl's. The one in particular that we send people to if they're looking for a higher quality shoe is Rotors. There's Rotors on North Main. There's also Rotors in Kettering. We don't have any affiliation, but we know that they provide good products, and they generally have people who are more experienced with shoe fitting. It doesn't mean that everyone in their store is extremely experienced, but there's at least one or two people working a shift that are experienced for proper fitting. Thank
Yeah,
you.
I agree with that, Mark. I've sent many patients in, and I think that kind of speaks to if you go to a shoe store. If you go to a sports store, you know, the person working in the shoe department that day might not always work in the shoe department. And so you might have someone who doesn't know or doesn't regularly look for all of the things that someone who works in a shoe store and sees shoes day in and day out might look for or notice or work with. So yeah, going to a shoe store as opposed to a sports store might also help.
Were there any other questions? So I want to thank Mark, Cherie, Emily for coordinating, for your time and your expertise, for answering questions. It was a really informative session, and we could do a round of applause. It could either be by the reaction button at the bottom. You can clap your hands. I like to do jazz hands, whatever works for you in the Zoom world. A big thank you. We really appreciate your time and your expertise, and a lot of thought and a lot of great tips too. I really appreciated the tip for diabetics or anyone who has neuropathy about doing a trace and taking that. So a lot of good tips in this session, and really are grateful for that. Grateful for everybody being here. Grateful for our program committee, currently chaired by Helene Gordon, who is on, and Marianne Bernstein, and everyone being present today. We do have another program coming up next week that we will include in the email that we send you afterwards with the handout. We have our pets, what to expect as we leave our houses, you know, as we've been home during, and we're talking about our pets coming into the session. As we leave our houses more after having been home for the pandemic, our pets are experiencing changes. They got used to us being home and different behaviors, and now they might be exhibiting some anxiety as we leave the house. And we have Dr. Denise Starr from the Northmont Animal Clinic, who will be speaking with us next week. And you can send us pictures of your pets too, that we'll include in the slideshow. So that's next Wednesday at noon. And we're also asking people for their stories about during the pandemic, about what you learned about yourself, or did you try something new, and sharing something with us. And we'll include that link. So thank you so much, everybody, for being here. We hope to see you at another program. Be well.
Thank you.
Thank you.
Thank you. Have a great day.